Okay, so today I have been ordered by a doctor to assess a patient by the name of Ivy Armstrong. They have just been admitted to the pre-op floor. Diagnosis has been an exploratory abdominal laparoscopy, and I have to insert an NG tube just to help with some of that excessive fluid that is on the stomach. So I gather all of my supplies, making sure I have no tears or rips or anything, doing my first med check at the fixes, just ensuring that I have everything that is for my patient. So the patient is, of course, Ivy Armstrong. We're going to be inserting an NG tube now, and it's going to be done via the nasal cavity. And once again, the effect is just to relieve some of that excessive fluid that is existing on the stomach at this time. So after gathering all of my supplies, I'm then going to be go ahead and heading into my patient's room. Knock, knock, knock. Hi, Ivy. How you doing?
I'm good. How are you?
I'm good, Ivy. I'm just going to set my supplies down for a second.
Okay.
Hi, Ivy. Can you verify your name and date of birth for me?
Yes, Ivy Armstrong, March 9th, 1964.
Okay, great, Ivy. Do you have any existing allergies that I need to be aware of?
Just latex.
Just latex? Okay, well, I won't be using any latex today. Are you having any pain at the moment?
No pain.
No pain? Okay, well, that's good. All right, at this time, I'm going to go ahead, well, my glove just ripped, so I will then go ahead and grab a new glove. This one rips. I was about to say this one rips. No. Go ahead and provide my patient with some privacy. All right, Ivy. So today I'm going to be going ahead and inserting an NG tube through your nose. Okay, it's not going to be the most comfortable procedure, but it's going to help relieve some of that excessive fluid that you have on your tummy. Okay.
Okay.
So in order to do the procedure, I'm going to have to raise your bed to a working height.
Alrighty.
As well as elevating the head of your bed to at least 45 to 90 degrees.
Yes, ma'am.
All right, Ivy, before I begin, I'm going to go ahead and ask you a few questions. Do you have any history of any facial trauma, any prior NG tubes that I need to be aware about, any nosebleeds of any kind?
No, ma'am.
No? Okay. So we're going to go ahead. Raise the head of the bed to about 90 degrees, whatever works best for you to get a good angle. I'm going to go ahead and try to go for 90.
Alrighty.
So, at this time, we would then, as we start preparing all of our stuff before we assess the patient once more, we're just going to go ahead and do our second med check. So once again, we know our patient's name is Ivy Armstrong. We're going to be inserting an NG tube now via the nostrils. That's going to be for the excessive fluid that's on the stomach. So we just did our second med check. All right, Ivy, so what I'm going to do now is I'm going to lay this towel across you.
Okay.
Just because things can get a little messy, okay?
Alrighty.
I'm going to lay that across you. Ivy, I'm also going to go ahead and give you this cup of water.
Alright.
Because I may need you to take a couple drinks or two while we're doing the procedure, okay?
Okay.
As well as I'm going to place this tray, and this is going to be for after I insert your tube, okay?
Okay.
Okay. So, at this point, we're going to go ahead and inspect the nostrils for any nosebleeds or any occlusion. There are none. And then we're just going to take a breath for me. Okay. Take a breath for me. Okay, Ivy, which side was easier for you to breathe out of?
My left side.
Your left side? Okay, well then we're gonna be putting your NG tube in via your left nostril, okay?
Okay.
Alright, Ivy, so at this time I am just going to go ahead and grab my supplies. Can I use your bed as my workstation?
Yes, ma'am.
All right, Ivy, I'm also going to go ahead and have you, I'm going to check your gag reflex, okay?
Okay.
Okay, good. All right, so I'm just going to go ahead and change my gloves at this time. Ivy, the last thing I have to do before we go ahead and get this tube inserted is I'm gonna check your bowel sounds. I'm gonna also take your abdomen for your bowel sounds, okay?
Okay.
So as I told you before, Ivy, this is not the most comfortable procedure. It can feel a little uncomfortable, but I'm gonna try to make this as comfortable as possible for you. I'm gonna try to move as fast as possible so we don't waste any time, okay?
Okay.
Okay. All right, so we're just gonna go ahead, uncover you a bit, okay?
Okay.
Okay, so we go. Okay, bowel sounds sound pretty even throughout, so that's good. All right, Ivy, at this time, I'm gonna go ahead and begin. So I'm
Alrighty.
just gonna go over the procedure with you one last time, just so you know you're crystal clear on what's about to happen. Okay.
Okay.
So once again, we're gonna go ahead and insert an NG tube in through your left nostril. And this is just gonna help with that excess fluid. It's gonna be able to get all that extra stuff that's going on up in there out. That'll help clear your airways a little bit. Okay.
Okay.
All right. So before I begin, I'm gonna go ahead and open up my packaging of my NG tube.
Okay.
At this time, I'd measure it. And how we measure it is we go from the tip of the NG tube to around our patient's ear to down to about where our xiphoid process is. So that's like right here in the middle of the chest. So on our mannequin, that stops at about 54. So at that point, we would then gather our tape. So we're gonna put our tape right there and mark off where we see the 54 mark at. So that's right before we get to 55. So mark this part off. And then since we're about to go ahead and start insertion, we're gonna go ahead and lubricate our tube. All right, Ivy, so I gave you your cup of water. What I'm gonna do is I'm gonna start to insert. I'm gonna advance it for about 2 to 4 inches. Once I insert, I'm gonna ask for you to cough for me, drink some water, and then I'm gonna continue with insertion, okay?
Okay.
All right, so I'm gonna go ahead and start. So 3, 2, 1. All right, Ivy, go ahead, take a drink for me. Go ahead, cough. All right, we're gonna go ahead and finish advancing. Okay. So we're, on a normal individual, on a real human, we would be at about our 54, 55 mark. But since we are on a mannequin at the time, we're gonna go ahead and stop right there. All right, so Ivy, I'm gonna go ahead, wrap it around there at that point. Grab my tape. I'm gonna temporarily tape it down. Right here. All right, Ivy, at this time, I'm gonna go ahead and we're gonna send you down an x-ray just to make sure that it is in the right position that we need it in. And then as soon as you get back, we're gonna test to see if x-ray determined if it was in the right position, okay?
Okay.
All right, so. All right, now our patient is back from x-ray, so we're just gonna go ahead and test to see if everything went successfully. So we are now just gonna go ahead. Get some gastric juice, okay, perfect. Gonna get our pH strip, test our acidity of our gastric juice, make sure that it is within a normal pH range. Test our strip. measure it. All right, Ivy, you're about a 4, so that's perfect. That means that the injury is in the right spot. So at this time, we are going to finish taping you down. So at this point, we would then grab our tape. Paper tape may be easier to use, but we're gonna have to work with what we got. So we would then split the tape in half, and then we would put it on our patient like so. Probably this right. I'll work with it. Okay, remove our temporary tape at that time.
I know, but I know your left side. I should have said left. And I was like, oh well, I'm just.
All right,
I
Ivy.
always said right because it's closer to the.
So now I am just gonna clean off your bed a little. And now I'm just gonna hook you up to some suction. So when we're hooking our patient up to the suction, we wanna make sure that we have our suction set in. Well, we can start off at continuous, and then we can move it to intermittent. We want it on intermittent, just, you know, for suctioning purposes. And then we can adjust it a little. And we want to make sure that it's in the green.
And after that,
So you can adjust it a little bit. So as we see, it's in the green. We always want to make sure that it's in the green. So at that point, we would then attach our suction. So we do clear to clear. And we are all done. Okay, Ivy, how you feeling?
Feeling good.
That's good to hear. Okay, Ivy, so at this point, I'm gonna go ahead and take this cup of water. I'll get you another cup in just a minute, okay?
Okay.
Get rid of this towel since we're all done. All right, Ivy, I'm gonna go ahead and raise it back down. Say that wasn't so bad, huh?
Not too bad.
Okay. So after we get our patient all the way bed set to the lowest height, we're gonna go ahead and raise the bed down a little bit. So I say the lowest it goes like 45 degrees. That's a good stopping point about right there. Make sure our patient has their call light. All right, Ivy, is there anything that I can do for you before I leave?
No, I'm all good.
Okay, so at this point in time, I would then remove my soiled gloves and for my hand hygiene. Then I would then document my completion of the procedure into the MAR to make sure that the procedure was in fact documented and that the patient's reaction to it was pretty good.
Alrighty.
So after I do such, I'm gonna gather up all of my supplies, toss any soil supplies, anything that we don't need anymore into the proper receptacle. All right, Ivy, I'll be back in about 30 minutes to check on you, okay?
Okay.
All right, you just give me a call if you need anything.
Okay, will do.
At that point, we would then proceed to exit the room.
Perfect.